Thank you very much for joining us. If you could just both introduce yourselves to start off with, that would be really, really good.
Okay.
Yeah. Go ahead, Hazel. Yeah.
Okay, my name's Hazel Marr. I'm a yoga teacher and a massage therapist from Inverness in Scotland.
And my name's Dave Mott. I'm a chartered physiotherapist from Paul in Dorset.
I was hoping you could start off by letting our listeners know about the subject you're looking to let them know about.
Okay, there's a big debate on just now. The government have just announced that they're going to hold a public inquiry into, amongst other things, this vaginal mesh surgery. And this is a medical procedure used to treat incontinence and prolapse in women, where a strip of plastic mesh is inserted into the vagina to support the womb, the uterus, or the bowel. And it's also a procedure which is used for rectal prolapses as well in both men and women. So it's beginning to raise the area of incontinence in women and really other alternatives to which have ended up in women having to get surgery.
So how many actually suffer from this?
Well, the statistics say about 1 in 3 women suffer from incontinence, and I have seen a statistic saying about 65% of women will suffer from incontinence at some point in their life. But because it's really an area which no one really wants to speak about or hear about, there's really probably a degree of underreporting because women just don't want to. It's a problem that is embarrassing for a lot of women, and it's very sensitive. And so whether that's a true statistic, but yeah, 1 in 3 is a common problem.
And is it sort of a problem to treat and difficult?
Well, I take this, Dave, as well. And the pelvic floor area, we again, people forget that the pelvic floor is part of the core muscle structure. It's the bottom of the core, and it's quite a complicated muscular setup. And lots of factors can contribute to incontinence. So pregnancy, childbirth, hormonal factors after menopause, stress, trauma, poor posture, poor breathing. And the muscles of the pelvic floor can be loose and weak, which would be stress incontinence, which really we're focusing on today. But they can also be tight and weak and lead to urge incontinence, which is another area. So it can be quite a complicated setup to consider all these factors and the best way to deal with stress incontinence, to deal with incontinence.
And I suppose it's one of those problems that you don't always think about or know much about until, it becomes a problem that affects you or someone you know.
Yes, absolutely.
So are there any sort of alternatives to this surgery?
Yeah, there's basically, women often get asked to do, so it could be men as well, but predominantly women will get asked to do Kegel exercises, which are essentially drawing up sort of exercises for the pelvic floor that you can do. Now, obviously, it involves a bit of effort, involves doing it on a regular basis. There's electrical stimulation as well, which essentially probes, so it's quite invasive, and to a certain degree, people find that uncomfortable and a little bit embarrassing. What we've been dealing with over the years is vibration platform training, and I've come around to using a particular product called Hypervibe. And it's just a very comfortable machine. I don't necessarily use it specifically for pelvic floor because I'm a musculoskeletal physiotherapist. But essentially over the years, I've had people that come to us for a particular condition, but they've also got stress incontinence. And the stress incontinence, once we've done the vibration training for something else, has improved. And they often ask, is this a coincidence? Because I've had this for 5 years and it's much improved. Well, there's no coincidence because of the way that the vibration works to stimulate the muscle activity.
So tell us more about how this therapy works.
Well, if you imagine that you go to your GP and they're testing your reflexes. So a classic one would be where they tap your kneecap tendon, and that stimulates a stretch reflex and causes one contraction of your quadricep, your thigh muscle, and that causes you to kick out your leg. It's involuntary, it's one contraction. But when you stand on a vibration machine, it stimulates hundreds and hundreds of stretch receptors all around your body, really from your rib cage downwards. And that then stimulates these reflexes, these reflex contractions. So they're involuntary, but happening all over, and especially your core. So that the stretch reflex is one mechanism, but then also because it's a vertical movement, it's a side alternating movement going upwards from the platform, it stimulates an increase in gravity. And when you've got an increase in gravity, that will stimulate the physiomotor system in your brain that stimulates the core muscles. So we know that the physiomotor system will do that. And when it's doing that, essentially it's working all the core muscles, including the pelvic floor. So it's a very simple way for people to engage their pelvic floor. It's non-invasive. You don't need to take off any clothes. You don't need to insert anything anywhere. And essentially the machine is doing work for you. So it's just I think the women like it because it's so easy, and you can have these machines. Hypervibe do a version, the home version now, which is fantastic quality, and it reaches the vibration frequencies it needs to reach to have the effect. And you can have these at home and have them in your bedroom, your kitchen, wherever, just to be able to stand on for a couple of minutes and do a couple of simple exercises, each day. And it really does make a good effect.
Was there anything else you'd like to cover or get over to our listeners that we've not covered in this interview?
I think it's worth saying, just to go back about the Kegels, if you ask women, I've seen statistics, there's very little research done on Kegel exercises, how many you're meant to do. I've seen between 5 and 200 a day. And there seems to be a lack of information actually about what a Kegel is, how you do them. And there's a confusion out there that there's really a lot of women just don't know what a Kegel is. And you really want to contract the whole of the pelvic floor, but learn to release as well. And I think the beauty of the whole body vibration machines is if it's stress incontinence and the muscles are loose, then the machine will contract the muscles as long as the machine is powerful enough. It needs to be a powerful enough vibration machine.
I think it's important to add actually that although there's not a great deal of knowledge about Kegel exercises as such, but there's also not much knowledge about vibration platforms. And really, I'd like to call out to physiotherapists in particular, to consider looking into this in more detail. I know there's not a great deal of research out there, but certainly there is some. And anecdotally, for me, working with these machines over 10 years, it's a really viable alternative for this type of problem to try and avoid surgery. So, any obs-and-gynae physios or women's health physios, it would be, I'd be delighted to hear and discuss this subject.
Is there anywhere our listeners can find out more information about this?
Yes, Facebook, Hypervibe UK have some information on there. They've also got a website, hypervibe.com. But more specifically, I think if you wanted to ask me or Hazel any questions, simple email to uk@hypervibe.com would be great.
Well, I'd like to thank the both of you very much for taking the time out to talk to me today.
Thank you.
You're welcome. Thank you.
Thank you.